and we discussed uh, narrow spectrum penicillin antibiotics and very narrow spectrum penicillin antibiotics. Now we will discuss. First, I would like to discuss on this structure. That is the structure of the penicillin antibiotics. That contains three parts. This part, that is the beta lactam ring, and that is the R side chain, and that is the branched chain of the beta lactam ring. The spectrum of the penicillin antibiotics depends upon the size of the penicillin molecule, and size of the penicillin molecule depends upon the beta lactam ring and R side chain attached to that. If we increase the R side chain, the penicillin shall be bigger, like penicillin G and penicillin V. These were the natural penicillins and they had the bigger size. And if we reduce R size of the penicillins, they will become smaller size molecules such as amoxicillin and ampicillin and other broad spectrum penicillin antibiotics. Hence, we have the option to reduce the size of the penicillins by reducing the R size of the penicillin molecules, and we can in this way we can enhance the spectrum of penicillin antibiotics. So here we will discuss wide spectrum penicillins. Uh, Wide spectrum penicillins are also known as broad spectrum penicillins. Broad spectrum penicillin is chemically modified by decreasing the length of the R side chain attached to the beta lactam ring. This shorter R side chain allows this penicillin to better penetrate the outer membrane of the gram-negative bacteria, expanding their activity beyond the narrow spectrum of natural penicillins, which mainly target the gram-positive bacteria. Here it is told that we can enhance the spectrum of the penicillins by chemically modifying them. If we chemically modify the natural penicillins, penicillin G and penicillin V, by reducing the R side chain, we can enhance their spectrum against the gram negative bacteria as natural penicillins don't have. Common examples of the wide spectrum penicillins include amoxicillin and ampicillin. However, this modification also presents some drawbacks. So, the modifications which we have provided in the natural penicillins, as we reduced R size in the natural penicillins and we provided modifications. So, such modifications have some drawbacks. Let's see. The first drawback is that the shorter side chain makes this penicillin more prone to degradation by the bacterial beta lactamase enzyme. When we are reducing the R size is actually protecting the penicillins from the beta lactamase attack. But if we are leaving the R side to be bigger, it will decrease the spectrum of the antibiotics. In order to enhance the spectrum, we have to reduce the R side chain. And if we are reducing the R side chain, it is increasing the attack of beta lactamase enzyme on those penicillins. So this means bacteria that produce these enzymes can more easily inactivate the drug. This means gram-negative bacteria which produce the beta lactamases, and we are also reducing the R size. We are reducing the size of the molecule, so those bacteria will easily attack on those penicillins because they contain the beta lactamase enzyme. These penicillins are less stable in the acidic environment, such as stomach, which reduce their oral bioavailability and then requires careful formulation to protect them from the gastric acid. As we decrease the R side chain, because of the reduction in the R side chain, then those penicillins become acid liable, and there shall be easy attack of this acids of the stomach on those molecules. So if we are reducing our size, we have to take care first for the beta lactamase enzymes, second for the acid stability. And for the acid stability, we have the option to use such polymers, such formulations like enteric coatings to protect them release in the gastric acid, but they will be released at the intestine. So, while the shorter R side chain enhance the antimicrobial spectrum against gram-negative bacteria, but it comes with the trade-off of increased beta-lactamase susceptibility and decreased acid stability. Here it is clarified that by reducing the side chain, spectrum will be increased, but beta lactamase will more easily attack on the penicillins, and also there shall be the decreased acid stability due to that change. So to overcome beta lactamase enzymes, we are using beta lactamase inhibitors with these penicillin antibiotics. And these beta lactamase inhibitors include clavulanic acid, sulbactam, and tazobactam. Common combinations that we have for broad spectrum penicillins include ampicillin, that is bound with the sulbactam, that is given in the combination with the sulbactam, and amoxicillin, that is given in the combination with the clavulanic acid. Uses of these combinations, especially broad spectrum antibiotics, amoxicillin and ampicillins, are in the HELPS infections. HELPS here is acronym, and that can be defined as uh, these penicillins are used to treat Haemophilus influenza that mainly cause respiratory tract infections. It means we can use amoxicillins and such type of penicillins in the respiratory tract infections, such as in tonsils or in the upper respiratory tract infections. We can use the amoxicillin. E. coli that cause the urinary tract infections. One of the main cause of the UTI is the E. coli. We can use amoxicillins or these broad spectrum penicillins against the E. coli. Listeria monocytogenes listeriosis, that also causes the Listeria monocytogenes causes listeriosis. We can use the amoxicillins against that bacteria that is causing the listeriosis. Proteus mirabilis, that causes the complicated UTI. We can use these broad spectrum amoxicillin penicillins against the complicated UTI, and the treatment of complicated UTI against the Proteus mirabilis. And salmonella, that is one of the causative agent of typhoid. We can use these combinations in the treatment of typhoid fever by targeting the salmonella bacteria. That's all about today's topic.